So when we're talking about lower face, jowls are one of the biggest concerns that I hear about. It's jowls and lips. So to start out with jowls, it's really important to note that we need to address the mid-face first. As we age, we actually start to descend from the mid-face down into the lower face. So by addressing mid-face first, we really make sure that that area is taken care of before we go into the lower face. One of my favorite tools to address the lower face is Morpheus. It is an incredibly powerful tool to sculpt the lower face and provide skin tightening while also improving skin texture. Botox can also be used along the jawline to reduce muscle tension on the lower face and provide a subtle lifting appearance. To explain the way that I address the jawline, it's important to think of the jawline as two poles, the chin as one and the posterior jawline as another pole. As we inject both, we actually stretch out the distance between the two poles and create a more taut rope, aka the jawline. A very common concern when addressing the lower face is, will my lips look natural? Will they look too big? Will they fit the rest of my face? It's really important that we address the other areas in the lower face, like the chin, in order to make sure that it fits. I commonly have patients who want to go a little bit bigger with their lips, but we really need to address the chin in order to make sure that it won't look off. I would say about 70 to 80% of patients who present for lip filler actually need some kind of chin contouring. You'll know that this is you if you have shadows that present all around your chin, or if when you draw a line from your nose to your chin, that line actually butts up to your lip. This is a common line that we use in plastic surgery that tells us if the nose, the chin, and the lip are all in synchrony. We take our time when injecting your lips to make sure that we deliver smooth results, and we listen to your goals so we can select the right product and the right technique and volume in order to assure that we can deliver the results that you're looking for. The jawline is a main area of focus for males, and the reason why is the lower face is oftentimes the dominant part of the face for males. So we address this area with dermal fillers, selecting products that are specifically formulated just for the jawline, like Volux and Voluma. Another common area of concern is the double chin. The double chin is actually best addressed by using 3 different modalities. Number 1 is Botox. We can relax the muscle that underlies this double chin area called the platysma, and that can relax the tension on the area. Morpheus is one of my favorite treatments for this area. It can tighten skin as well as contour the jawline. Dermal filler in the chin is another great way to instantly improve this area. By adding volume to the chin, we actually pull the skin underneath the chin taut, and it tucks it right up underneath and gives you an immediate result. The 4th modality that we can use to address the lower face is suspension thread lift. So we actually place the suspension threads here in the cheek, and you'll get a lift all through the mid-face as well as the lower face. We can also use the suspension threads along the jawline and underneath the jawline as well, but they're just a little bit harder to get the results that you're looking for, because oftentimes the weight that you're seeing in your lower face that's giving you that lower face fullness is coming from the mid-face descending onto the lower face. So really lifting through the mid-face first with either threads or dermal filler is a great place to start in order to really get that augmentation in the jawline that you're looking for.